Preventing pregnancy. Naturally. What works and what doesn't? Many couples look for natural ways to prevent pregnancy after sex. If you are not ready for a baby, it is important to understand your options. Some natural methods may help reduce the chances of pregnancy, but they are not as effective as medical options. Knowing how the body works and using the right methods at the right time can make a difference. Understanding fertility, tracking ovulation, and making informed choices can help manage reproductive health naturally. However, it is important to recognize that natural methods are not foolproof and should be used with caution. One of the first things to consider is timing. The chances of getting pregnant are highest during ovulation. Ovulation happens when the egg is released from the ovary, usually in the middle of the menstrual cycle. If you have unprotected sex during this time, pregnancy is more likely. Tracking your cycle can help you understand when you are most and least fertile. If you have sex during your fertile window, natural methods may not be very effective. Some women use fertility awareness methods to track their cycle and avoid sex during fertile days, but this requires careful observation and discipline. Natural methods like calendar tracking, basal body temperature monitoring, and cervical mucus examination can help predict ovulation, but they are not always accurate. One method people use is withdrawal, also known as the pull-out method. This involves the male partner pulling out before ejaculation. While this can reduce the chances of pregnancy, it is not foolproof. Some sperm may still be released before ejaculation, which can lead to pregnancy. This method requires a lot of control and is not always reliable. Additionally, it does not protect against sexually transmitted infections. Many couples rely on this method, but the risk of pregnancy remains high, especially if withdrawal is not timed perfectly. The presence of sperm in pre-ejaculatory fluid is also a concern, making withdrawal less effective than other contraceptive methods. Another approach is washing immediately after sex. Some believe that washing the vaginal area or urinating after sex can prevent pregnancy. While this may help clean the area, it does not stop sperm from reaching the egg. Once sperm enters the cervix, washing or urinating will not remove it. This is not a reliable method to prevent pregnancy. Sperm can move quickly after ejaculation, and external washing has no impact on their movement inside the reproductive tract. Urination after sex can help prevent urinary tract infections, but it does nothing to prevent conception. Some people use lemon or vinegar as a natural spermicide. They believe that these substances can kill sperm. However, there is no scientific evidence to prove that they work effectively. Inserting acidic substances into the vagina can cause irritation or infections. It is not a safe or recommended method. Many of these substances can disrupt the natural pH balance of the vagina, leading to discomfort and an increased risk of infections. Despite traditional beliefs about their contraceptive properties, there is no reliable research to support their effectiveness. Breastfeeding can sometimes act as a natural contraceptive. This is known as the lactational amenorrhea method, LAM. If a woman is exclusively breastfeeding, it can delay ovulation. However, this method only works under specific conditions. If the baby is not breastfeeding frequently, or if menstruation has returned, this method may not be effective. The hormones involved in breastfeeding can suppress ovulation, but this effect diminishes over time. After 6 months, the chances of ovulation increase even if breastfeeding continues. Relying solely on breastfeeding as a contraceptive method can be risky, especially if a woman is not following the strict guidelines that make LAM effective. Some herbs are believed to have contraceptive effects. Herbs like papaya, neem, and parsley are often mentioned as natural birth control options. Some people believe that eating raw papaya after sex can prevent pregnancy. Neem is thought to have sperm-killing properties. However, there is no strong scientific evidence to support these claims. Herbal methods are not reliable and may have side effects. Some herbs may interfere with hormonal balance or cause digestive discomfort, making them unsafe for regular use. While traditional medicine often includes natural remedies for contraception, their effectiveness varies, and there is little clinical research to confirm their reliability. Emergency contraception can also be considered. Some natural remedies claim to work as emergency contraception, but they are not backed by research. Medical emergency contraception, like the morning after pill, is more effective. However, if you prefer natural options, there is no guaranteed way to prevent pregnancy after sex. Many natural remedies lack scientific validation, and relying on them can increase the risk of unintended pregnancy. Medical emergency contraception works by delaying ovulation or preventing fertilization, but natural methods do not offer the same level of certainty. Practicing fertility awareness is a long-term natural method. This involves tracking ovulation and avoiding sex during fertile days. This method requires careful monitoring of body temperature and cervical mucus changes. While it can be effective when used correctly, it takes time and practice to master. Many women find it difficult to track their cycle accurately, and external factors like stress, illness, and hormonal imbalances can affect ovulation. Fertility awareness methods require commitment and consistency, which may not be practical for everyone. Another natural method involves consuming foods believed to have contraceptive properties. Some people believe that certain foods, such as ginger, figs, or cinnamon, can help prevent pregnancy. However, there is no medical proof that consuming these foods after sex will stop pregnancy from occurring. While some foods have properties that may affect hormonal balance, their contraceptive effects are not well understood. Myths about certain foods preventing pregnancy persist, but they should not be relied upon as a primary method of contraception. Some people turn to physical activities like jumping or intense exercise after sex in the belief that it can prevent pregnancy. This idea is based on the assumption that movement will expel sperm from the body. However, once sperm enter the cervix, physical activity will not affect their journey toward the egg. Exercise has many health benefits, but it does not work as a contraceptive measure. The idea that certain movements can prevent pregnancy is a misconception, as sperm are designed to move quickly through the reproductive tract. There are also traditional beliefs that suggest consuming high doses of vitamin C or aspirin can prevent pregnancy. Some believe that these substances interfere with implantation. However, there is no scientific evidence to support these claims. Taking excessive amounts of vitamins or medications without medical guidance can be harmful to health. While some people swear by these methods, they lack clinical validation and should not be used as primary contraceptive measures. Using natural methods to prevent pregnancy after sex comes with risks. Most natural methods are not highly effective, and pregnancy can still happen. If you are looking for a reliable way to avoid pregnancy, medical options like condoms or birth control pills are more effective. Understanding your body and planning ahead is the best way to stay in control of your reproductive health. While natural methods can be appealing due to their non-invasive nature, they are generally less reliable than modern contraceptive methods. If preventing pregnancy is a priority, using a combination of natural and medical approaches can provide better protection. For those who prefer natural methods, combining different strategies may improve effectiveness. For example, using withdrawal along with fertility awareness tracking can provide better results than relying on a single method. However, no natural method can guarantee 100% effectiveness. Consulting a healthcare professional can provide better guidance on safe and effective birth control options. If you are unsure about which method is best for you, seeking professional advice can help you make an informed decision. Ultimately, preventing pregnancy requires careful planning and an understanding of how reproduction works. While natural methods have been used for centuries, they come with limitations. If you are looking for a foolproof way to prevent pregnancy, medical contraceptives are the best option. However, if you choose natural methods, being aware of their risks and limitations can help you make the best choice for your reproductive health. Educating yourself and staying informed about different contraceptive options can empower you to take control of your fertility and make decisions that align with your personal beliefs and lifestyle.